As someone who has worked with thousands of senior patients, I want to share the most important advice about end-of-life planning. It's crucial for ensuring our wishes are honored during medical crises. Understanding health directives and having tough conversations now can spare your loved ones from difficult decisions later. These conversations give you control over your health care choices, promoting peace of mind for you and your family. End-of-life planning involves setting up health directives that act like a guidebook for your future health care. Imagine it as a way to ensure your voice is heard, even if you're unable to speak. This includes living wills and healthcare proxies, which designate someone you trust to make decisions on your behalf. Understanding these legal tools can help demystify the process and make it less daunting. It's important to recognize when it's time to initiate these conversations. Look for signs like frequent hospital visits or a recent medical diagnosis. Self-awareness and timely discussions with your family and health provider can ensure your preferences are known. Remember, talking about what we fear can often reduce anxiety and bring clarity. Practically, consider how your diet supports your health as you age. Eating well can extend both lifespan and quality of life. Focus on nutrient-rich foods like leafy greens, lean proteins, and whole grains. Plan meals that are easy to prepare and consider family-friendly recipes that promote health and togetherness. Staying active with safe and gentle exercises, such as yoga, walking, or Tai Chi, is essential. These activities enhance flexibility and strength, which are crucial as we age. Always prioritize safety by starting slowly and consulting your doctor for personalized advice. Remember, even small movements can yield big impacts over time. Regular medical checkups help monitor your health effectively. Collaborate closely with healthcare providers to manage chronic conditions and adjust any treatments as needed. Knowing when to seek help and maintaining open communication with your medical team can significantly enhance health outcomes and prevent complications. Addressing mental health is just as important. End-of-life planning can affect emotions and relationships. Engage in activities that bolster a positive mindset, like gardening or art classes. Maintain social connections through community events or groups, as they provide support and joy in daily living and enhance overall well-being. To wrap up, mastering end-of-life planning leaves you empowered. Review health directives regularly and update them as needed. Open dialogues with loved ones, ensuring everyone is aligned. Remember, taking charge of your health now paves the way for a dignified, fulfilling future. You have the tools to shape your journey towards a confident and proactive approach to aging.